All right, today we're going to talk about gout. Now, you've probably heard of it. It's this incredibly common type of arthritis that's famous for being, well, intensely painful. But here's the thing I want you to remember from the get-go. As bad as it can feel, gout is a completely controllable disease. So let's get right into it and break down what's really going on.
Just imagine this for a second. You go to sleep feeling totally fine, and then bam, you wake up in the dead of night with this absolutely excruciating, throbbing pain, usually in your big toe. The joint is bright red, it's hot, it's swollen, and it's so unbelievably sensitive that even the weight of a bed sheet feels like a ton of bricks. That right there is the classic out-of-nowhere ambush of a gout attack.
So what is happening inside your body to cause such a violent reaction? I mean, how can a joint go from being perfectly happy to pure agony in just a matter of hours? That's the mystery we're going to solve.
To solve this, we've got to zoom in. I mean, way in, down to the microscopic level to find the real culprit behind all this chaos and pain.
Okay, so let me introduce you to the main character in this story, uric acid. Now, it's not the bad guy you might think it is. It's actually a totally normal waste product our bodies make all the time when we break down these things called purines. And purines are, well, they're everywhere. They're in our own cells, and they're in a lot of the foods we eat.
You can think of your body as having this really well-designed system for managing uric acid. It's made, and then your kidneys and your gut are supposed to clear it out. Simple enough, right? Well, gout happens when that system gets overloaded. Either your body starts making way too much uric acid or, and this is actually more common, your kidneys just can't keep up with filtering it all out.
And that overload is what leads to an attack. It happens in these 4 basic steps. First, the uric acid levels in your blood get too high. That's a condition called hyperuricemia. Second, once it's super concentrated, it can't stay dissolved in your blood anymore. So it crashes out and forms these microscopic, super sharp needle-like crystals that settle in a joint. Third, your immune system spots these sharp little invaders and, thinking they're a threat, launches an all-out attack. And finally, that huge immune response is what creates the crazy inflammation, the swelling, and all that pain.
And right here, you can see the scene of the crime. Those sharp little crystals are just sitting there inside the joint. It's so important to get this. It's not the uric acid itself that hurts. It is your own body's massive, full-scale war against those crystals that causes the incredible, agonizing pain.
So, if high uric acid is the cause, then what leads to high uric acid in the first place? Let's peel back the layers and unmask some of the most common triggers.
So yeah, a bunch of different things can tip the scales. A diet that's heavy in high purine foods, think red meat, organ meats, some types of seafood, that just adds more fuel to the fire. Alcohol is like a double whammy. It ramps up uric acid production and makes it harder for your kidneys to get rid of it. Things like obesity, kidney disease, even certain blood pressure meds can throw that delicate balance off. And, it's also way more common in men because estrogen in premenopausal women actually helps the kidneys clear uric acid out.
Now, if you don't get a handle on it, gout tends to move through 4 stages. It all starts silently. High uric acid, but you feel nothing. Then come those awful, painful acute attacks. After an attack, you might have these symptom-free periods in between. But if that underlying high uric acid level isn't fixed, it can become chronic, forming these hard, chalky deposits of crystals called tophi in the joints, which can cause permanent damage.
But here is the really good news. We have a super effective strategy for managing gout. You just have to think of it like a battle fought on 2 fronts. You have to deal with the fire that's burning right now, and then you have to prevent new fires from ever starting.
This is probably the most crucial thing to understand. The acute treatment, that's like being a firefighter. Your house is on fire and your only job is to put that fire out right now. The chronic therapy, that's fire prevention. That's about fixing the faulty wiring in the house so a fire never ever starts again. 2 totally different goals.
Okay, to make this super clear, let's walk through a classic clinical case. We've got a 45-year-old man who shows up with that textbook symptom, sudden, terrible pain in his big toe. He also has a history of drinking alcohol. This is about as classic as a gout presentation gets. So, how do we help this guy right now?
For that acute attack for fighting the fire, we've got 3 main tools in our toolbox. First line is usually NSAIDs, like naproxen. They're fantastic at knocking down pain and inflammation fast. Another option is a drug called colchicine, which basically tells the immune cells to calm down and stop attacking the crystals. And then there are corticosteroids,
which are just powerful all-around anti-inflammatories we can use if the other options aren't a good fit.
So for our 45-year-old patient, priority number 1 is pain relief. We'd start him on an NSAID to put out that fire in his joint and get him comfortable as fast as humanly possible.
But remember, stopping one attack is only half the battle. Now, we shift our focus to fire prevention. This is all about winning the long game and making sure this never happens to him again.
The goal of long-term therapy is super simple. Get the uric acid level in the blood so low that those crystals physically cannot form. And the best part is, if you keep it low enough for long enough, existing crystals can actually start to dissolve. The go-to drug here is allopurinol, but this is so important. These meds are not for the acute attack. You don't start fire prevention while the house is still burning. You wait until the flare is over, and then you start the long-term plan to make sure it's the last one.
And look, medication is a huge piece of the puzzle, but it's not the whole story. Lifestyle choices are absolutely essential. We're talking about shifting to a diet with less red meat and more fruits and veggies, cutting back on alcohol, getting to a healthy weight, and staying really well hydrated. All of these changes work together with the medication to give you more and more control.
And really, this is the most important message I want you to walk away with. Yes, gout is painful, but it is not a life sentence. With the right combination of treating the attacks, preventing future ones, and making smart lifestyle choices, it is a completely manageable, controllable disease.
So, let's end with this one last thought. Way back when, gout was called the disease of kings because only the wealthy could afford all the rich food and alcohol that triggered it. But today, it affects millions of people all over the world. It really makes you stop and think, what does the rise of a disease like gout tell us about the massive shifts in our modern diet and our overall health? It's definitely a question worth pondering.